welcome back to Fertility Fact or Fiction, the best infertility show on the web, if we do say so ourselves. We are happy to have you guys back. We have a great topic tonight. It's not actually a study. We're just going to review everything we know about marijuana to date and fertility. So I hope you guys are watching. We hope that you've had a good week, and hopefully more and more of you are getting vaccinated so we can end this horrible plague that has been ruining all of our lives for over a year now. So I hope you guys are well. Welcome back. As usual, we're going to let everybody have a chance to jump on board and make sure that you can join us, and we're going to grab some tea. I've got my jasmine tea back, and I've got Tarek back. So thank you to all of you for your well wishes last week. Tarek was unavailable due to some personal health concerns, but he is now back by my side, so he's manning the computer.
COVID, not COVID.
It was not COVID, he wants me to say. So he's back and he's in command again, so we should have a smooth and good running show. Hopefully we're up on Instagram too. Did you check? So hopefully everybody can hear us. There shouldn't be any sound problems or visual problems. Everything should be good to go, and we're going to get started shortly. So I actually have kind of a PowerPoint presentation for you guys tonight, and we'll go through the individual little topics and review everything. And then if you guys have questions, I'm more than happy to take your questions. So I think we can probably get started if we've got enough of a build up there. I think we're still waiting for a few more folks to join on and go from there. Nothing really exciting in the infertility world lately. No major breakthroughs, no major announcements. In fact, one of the reasons I ended up choosing this topic tonight was because there's actually very little even coming out research-wise to share with everybody that's momentous enough or significant enough for us to present to you guys. And we do get a lot of views on our YouTube channel now for any video we put out. So these informational type presentations, I figured were a good deal. I also think it's a great opportunity to point out the fact that the recent post we put out on Instagram on how miscarriage is allowed time off, paid leave in New Zealand, got 17,500 people to view it, and yet Instagram didn't promote it, and we actually had 2 less followers as a result. So that necessitated my putting out my other post about how I have no idea how Instagram math works, and it's been an interesting social media uphill climb with Instagram. But YouTube is easy. We get about 20 new followers a day, and the videos do really, really well. So thank you for all of those of you who have watched and spread the word and shared and liked and commented. So we'll definitely continue building up that element of our practice. Okay, so we're going to start with our slideshow. So the question is marijuana safe when you're trying to conceive? So that should be the first slide. Is it up? Yep. Okay, perfect. So this is an interesting topic. We have had all sorts of people come in who believe it's safe. We've had people who refuse to go off. We've had men, we've had women. Typically it's the guys that don't want to stop, but we have had women that are using. I had an egg donor not too long ago who was using it several times a day. And when I spoke to her about it, I said, listen, you cannot use marijuana during your fertility cycle, so it's imperative that you stop. And she said, well, let me think about it, and then was kind enough at least to call me back a week or so later and very honestly tell me that she couldn't stop. So it is like a major part of our culture now, in particular in Canada where it's now legal. It's actually fairly difficult to get people to not be on marijuana. And that can include surrogates or egg donors or the patients themselves. So I thought this is a hot button topic. Let's review it and see what we can help bring to people's attention. So we're going to go to the first slide. So Marijuana use is way more common than anyone would anticipate. So obviously it's becoming more and more common in countries where it's legalized. It's obviously very common. And most people don't understand the harmful or the detrimental side effects of using marijuana. So the question is, what is the epidemiology of this with fertility? So 9.8% of people will use marijuana while they're trying to conceive, up to 13% of patients that were presenting to a fertility clinic. So that's a fair number. I mean, that's about 1 in 7, 1 in 8. So there's a lot of people that are using. And these are patients that are actually trying to get pregnant and having difficulty. So it's the representation of the same folks out there like you who are watching this show. Interestingly, in one study that they looked at, they said 72% would have agreed to stop if they were asked to, and only 9.4% were actually asked to. So as physicians, we are not doing a good enough job in telling patients to stop or to quit or to at least hold off. Now, all of you who have watched our show or have come to see me know that I am vehemently opposed to any smoking, any drug use, and I try to eliminate or at least absolutely minimize alcohol intake. But obviously other physicians are not doing that. They're just letting patients continue. And why do I do this? Well, I'm going to show you that the data is strongly in favor of not using marijuana. And as a result of that, we want the very best for you guys. And that's why we tell you to stop. So you'll see through the data here that it's important. More importantly as well is that many people are continuing marijuana use even through the pregnancy, and that's over 5%. And there are different reasons like nausea and vomiting, and some women are using it to sleep better. And in many cases, it's just addiction. And although people don't believe you can be addicted to marijuana, there are a lot of people that are actually addicted to marijuana. It is an addictive substance. So the prevalence of this is very high. The incidence of the use of this is quite high. And as more states and more countries make it legal, you're going to see a higher use and a growing use over time. So this is really important. So we're going to go to the next slide. So these are kind of just the objectives here, and it's to talk about the safety of this. So is it safe? So we're going to look at sperm parameters. We're going to look at female parameters. We're going to look at the embryo factors, the fetal factors, and then at the end, we're going to briefly talk about sexual function. Oops. And I'm going to sneeze. Oh, excuse me. Okay, so sperm parameters. So I found this great pic in the background that looks like marijuana sperm. So I love that image. Well, thank you, Shutterstock. So there are meta-analyses of how it impacts sperm parameters. So a meta-analysis, remember, is when they take a bunch of different studies and they pile them into one to get one bigger study. So the studies show in 6 out of 7 that there was a reduced sperm count by almost a third, significant reduction in sperm motility, anywhere from 28 to 56%. Now they do specify that if your sperm motility is really good, it's only a 28% reduction, which is still very significant. If your sperm motility is not very good, it's an even greater reduction in motility. So that's really critical. They looked at morphology, which is the shape of the sperm. Are they normal or abnormal? And remember, the abnormal ones are not thought to work. And there is a 94% increase in the number of men that have less than 4%, only 4% of their sperm having normal morphology, which is just an absolutely massive increase, okay? They then looked at viability, so that's the number of sperm that are actually alive, and they saw a dose-dependent reduction. So the more marijuana you use, the less of your sperm that are going to survive. And then they looked at activation and fertilization, and that's the ability of the sperm to actually activate and cause what's called an acrosomal reaction in the egg when it binds, as well as the chance that it will actually fertilize. And again, they showed significant reductions. So from a sperm parameter standpoint, when we're looking at the number of sperm, we're looking at the motility, we're looking at the morphology, and then the viability, there is no question that it is significantly hampering the function and the quality of the sperm. So we're going to move to the next slide. So the next part of this is, what if you're not just looking at those parameters? What about sperm DNA fragmentation? So we've talked about sperm DNA fragmentation on the show. There are people more and more now that are adopting sperm DNA fragmentation into their practice because it does look like it has a significant impact on some outcomes. So for IUI, if your sperm DNA fragmentation is high, there are some studies that show no success. For IVF, you're probably getting decreased fertilization, decreased blastocyst production, and we know for a fact that you are getting a higher rate of miscarriage. And that miscarriage rate is much, much higher, almost close to 12 times higher than normal in one study we reviewed here on the show early last year sometime. So with sperm DNA fragmentation, the risk is that you're going to compromise your fertility, you're going to increase your miscarriage risk. So it is a 250% increase in the risk of miscarriage, even if it's only the male using the marijuana. And it's a 60% increase in chromosomal abnormalities in the sperm. 60% increase in sperm DNA fragmentation as well. So a huge, huge alteration in the quality of the sperm, a huge alteration in the numbers. You are seeing massive increases in abnormalities. So remember that inside your sperm there are chromosomes, and this is showing that 60% of the sperm will show an increase in the sperms having chromosomal abnormalities. You'll have a 60% increase in DNA fragmentation and 250% increase in the miscarriage risk, even if you are successful in helping your partner conceive. So this is critical and clearly very, very damaging to the sperm quality. So incontrovertible, this stuff is like hardcore nailed down science. They know that these are problems. Okay, so we're going to go to the next slide. So looking at the female impact, it's a little bit harder because there actually is not a lot of data looking at this. So hard to know because it's hard in a woman to figure out if there's an impact on egg quality and sperm quality, or on fertilization and so on, because it's hard to kind of do a randomized controlled trial. You can't really intentionally expose people to marijuana. And it's hard to follow because you don't know about all of the other confounding factors in a female, which you can't necessarily control for as easily. What we do know, it extends ovulation by anywhere from 1.7 to 3.5 days. And oftentimes the longer it takes for you to develop your egg, the lower the quality of the egg. It can increase anovulatory cycles. So in one study alone, 43% of the women that were not having periods were marijuana users, even though they actually only represented 15% of the total population of women they were looking at. So huge increase in the chance that you won't ovulate. There does not appear to be a significant difference in implantation, clinical pregnancy rate, or live birth, but if you go to the next slide, you'll see that it again doubles the risk of miscarriage. And this is from a study looking specifically at women, analyzing what their outcomes were with IVF. And they showed that if the woman was using IVF, the risk of miscarriage was double the background rate. So obviously you're going through all that trouble, all the angst, all the emotion, and now you've got double the background risk of a miscarriage, especially after you've spent probably a fortune paying for your IVF cycle. There's also significant alterations in the endometrium and placental development. So the development of the lining of the uterus and the development of the placenta are significantly altered by marijuana and the THC. How much so? 1/3 of the THC that's in a woman's blood will actually cross the placenta. So you know that your baby is actually being exposed to the marijuana on an ongoing basis at a relatively high concentration. And in case you weren't aware of this, the cannabinoid system, which includes the receptors for THC, is present all over the human body, including neurodevelopmental tissues, reproductive tissues. And the authors of these studies are saying it can be a significant enough alteration in the fetus that it can actually have lasting impact that your fetus could actually then be passing on to its offspring. And therefore you could be affecting your fetus is then affected for life and passing that down through the generations. So this has very, very tangible, significant negative impact on reproductive health. So final slide is to see fetal factors. So we have this confused little baby. And why do we have a confused little baby? Because it can actually impact fetal development. So babies that have been exposed to marijuana in utero have decreased sleep. They have fundamental anatomical changes in the areas of the brain that regulate emotion. They're at a higher risk for having intrauterine growth restriction, heart defects, and they have reduced viral immunity, something that up until recently we probably wouldn't have been jumping up and down about, but that we now have to be very cautious of because we're in a worldwide global pandemic, obviously caused by a virus. So these babies have weaker immune systems, specifically against viruses. They can be smaller. Remember, being smaller, you might think, oh, easier delivery. No, the problem with being smaller is when these children grow up to be adults, they're at a higher risk of high blood pressure, heart disease, diabetes, many other health conditions. So being smaller is not a minor thing. They also have lower IQ and reduced verbal and abstract reasoning scores. And as though that wasn't enough, as they get older, the risk of having attention deficit hyperactivity disorder is also elevated and increased. The last thing that we looked at was sexual function. So if you flip to the next slide, you'll see that this guy is holding the ubiquitous little blue pill. And the reality is that it increases the rate of erectile dysfunction by double. So you are doubling the chances that you will have sexual dysfunction, making it obviously that much harder for you to get pregnant. Now, interestingly, in women, if you were using low doses, they said it improved your sexual function. But at higher doses, again, it slowed down or retarded the sexual function in women when they were smoking more frequently. And so on balance, when you look at this in terms of the benefits of having an improved sexual function versus all of the risks with miscarriage, alteration of the baby's anatomy, the brain function, outcomes long-term, ADHD, miscarriage risks, and so on, there is no question that that small increase for women that are suffering from sexual dysfunction is not even close to being worth it for the risk that you're taking in staying on marijuana. So this isn't quite a factor of fiction. I don't get to kind of slam the gavel as I normally do and say, is it a factor of fiction? But the reality is there is no element of marijuana that is safe when you are trying to conceive or when you are pregnant. Now, there are some studies that have shown in men that there are some improvements to sperm quality. That was one of the studies. And there's actually even one study that showed an increase in live birth. However, it's still not counteracted by all of these other elements, including the increased risk of miscarriage, all of the adverse sperm parameter effects, and all of the other health effects that it has. Years ago, there was an excellent article released as a review article in the New England Journal of Medicine, which reviewed the actual adverse side effects of marijuana use. And the one that is the most convincing of all is a study of CT scans of brain volume in users versus non-users. So when they compared men and women over the age of 50 and did CT scans of their brains to see if there were any differences comparing the never used to the previously used marijuana patients, they demonstrated that the brain volume was statistically significantly smaller in patients that actually had that had used marijuana compared to the patients that had never used marijuana. So we've known for a long time it can be damaging to neurological tissues. And in many cases, it can alter or even destroy your neurological tissues. And therefore, if it is shrinking your brain volume, that cannot be a good thing long term. Those people have a higher rate of blackouts, memory loss, difficulty concentrating, short-term and long-term memory problems, focus deficits, all of these things. So In the same way that it gives you that ADHD when you're younger, this can have much longer lasting impacts than just that, well into your adulthood and into your senior years. So overall, is it safe to use marijuana when you're trying to conceive? It is absolutely not safe to use marijuana when you're trying to conceive. So thank you for watching that part of our show. We love doing this for you guys. Make sure you like, comment, and share, and subscribe to our YouTube channel where all our videos are available for you. It's www.youtube.com/drvictory for Dr. Victory. And thank you to Tarek for running our show for us and getting this all up there in a format that hopefully people on Instagram could see as well. So we are gonna take questions now, and I think Tarek has a whole bunch of questions for us, I'm sure.